Hello friends, in this video we'll see the preparation series of Aiims Norcet and Jipmer Nursing Officer exam part 4. So this video presents to you important questions from nervous system. Welcome to Master Nurse. Question number 1. The parts of the brain stem include dash A. Midbrain, pons and medulla. B. Pons and medulla. C. Midbrain and medulla. D. Pons, cerebellum and medulla. The right answer, midbrain, pons, and medulla. So the midbrain, pons, and medulla together are called the brainstem. The brainstem is an important part of the brain because it connects the brain to the spinal cord, and it is also responsible for vital functions of the body such as breathing, consciousness, BP, and etc. Also, it contains nuclei for cranial nerves. 10 important cranial nerves arise from the brainstem only, which are cranial nerves 3 to cranial nerve 10, 3 to 12. 3 to 12, the 10 cranial nerves arise from brainstem only. So this is the clinical significance of the brainstem. Question 2. The cell that is more sensitive to hypoxia is dash, which means cells in the body that are more sensitive to oxygen deprivation is dash. A. Stem cell. B. Neuron. C. Liver cell. D. Nephron. The right answer, B. Neuron. The brain cells or the functional units of the nervous system, that is neuron, is very sensitive to hypoxia. The exact reason is clearly unknown, but research suggests that there is an enzyme which is called as NOx4. This enzyme is present all over the body, but it is harmful only for neurons because this NOx4 enzyme is activated when hypoxia begins, when there is low oxygen in the neuron. So at this point, what happens is the NOx4 enzyme triggers the breakdown of blood-brain barrier and also triggers the self-destruction of neurons. Neurons are self-destructed. That is why when there is oxygen deprivation, the brain is affected first. Question 3. The largest nerve in the human body is dash. A. Sciatic nerve. B. Femoral nerve. C. Obturator nerve. D. Pudendal nerve. The right answer, A. Sciatic nerve. So sciatic nerve is the largest as well as the longest nerve in the body. So this nerve, the root of this nerve starts at L4 to S3, the lumbar vertebra 4 to sacral vertebra 3, S3. There is a plexus there, a group of nerves. It starts from this place. The sciatic nerve arises at this spot and reaches up to the feet. It has both sensory and motor functions as well. And the clinical significance of sciatic nerve is the well-known IM injection. So what happens is when you give IM injection, you are asked to give the injection in the upper and outer quadrant of the gluteal muscle to avoid damage to the sciatic nerve. Any damage to the sciatic nerve can affect the movement of the lower limb. The next question. The Broca's area is situated in dash. Where is the Broca's area situated? A. Temporal lobe. B. Occipital calcarine fissure. C. Inferior frontal gyrus. And D. Mammillary body region. The right answer, inferior frontal gyrus. So where is this inferior frontal gyrus? It is in the frontal lobe of the brain. So the Broca's area is situated in the frontal lobe in the opposite side of the dominant hemisphere, which means if you are a right-handed person, it will be in the left hemisphere. If you are a left-handed person, it will be in the right hemisphere. So what is this Broca's area? Broca's area is also called as the script writer of the brain. It is responsible for all the speech activities that the brain coordinates. For example, from the temporal cortex to the motor cortex, when the speech is regulated, the Broca's area only makes the plan for the speech. So how loud to speak, how much air has to come, the breathing during speech, also the body language of the speech is activated by the Broca's area only. So any problem to the Broca's area can cause speech difficulty and aphasia. Next question. The plexus that supplies nerves to skin and muscles of upper limb and some chest muscle is dash. Cervical plexus, brachial plexus, lumbar plexus, and sacral plexus. So the question is, the plexus that supplies to nerves of upper limb and some chest muscle. So here we should know what is a plexus. Plexus is nothing but a bundle of intersecting nerves that arise from the same origin. So there are some important plexus in the body. We'll see the right answer is brachial plexus. So the brachial plexus is found near the shoulder and the neck. So it supplies to the upper limb and chest muscles also. Other important plexus like cervical plexus, it supplies to the head and the shoulders. The brachial plexus supplies to chest and the shoulder and arms. Lumbar plexus supplies to back, abdomen, groin, thigh, and calf muscles. Sacral plexus supplies to pelvis, genitals, thigh, and the foot. Question 6. Which cranial nerve disorder causes Bell's palsy? A. Facial. B. Trigeminal. C. Vagus. D. Vestibulocochlear. The right answer, A. Facial nerve. So what is this Bell's palsy? So we all know that Bell's palsy is a nervous disorder that happens because of the problem in the facial nerve. So what happens here is one part of the face, which means one side of the face muscle becomes weak. There is weakness in one side of the facial muscle, which causes pulling of the mouth to one side, inability to close one eyes, inability to swallow, drink, or spit. All this can be seen in Bell's palsy. Usually Bell's palsy get treated by itself and it will get cured within 3 to 4 weeks or maximum 6 months in most of the cases. So this facial nerve is the seventh cranial nerve. Any problem to this can cause Bell's palsy. It has both motor function, sensory function, and parasympathetic function. The motor function of the facial nerve is movement of facial muscles, smiling, frowning, raising the eyebrows. All this is done by the facial nerve. Sensory is taste. It also gives taste. It receives the taste impulses from anterior two-third of the tongue. And it also has parasympathetic supply to glands in the head and neck, especially to the lacrimal glands and etc. Question 7. While performing Romberg test, the nurse must ensure patient's dash. A. Gait. B. Safety. C. Posture. D. Diet. The right answer, B. Safety. So we should know what is a Romberg's test. Romberg's test is a test that is neurological test to assess the proprioception of the patient, which means the balance of the patient. So the balance of the patient is usually coordinated by the cerebellum. Even the patient is closing the eyes, the balance might change. When they have some problems in the ear, their balance might change. So in some disease conditions, the balance of the patient will be affected. To test this, the Romberg test is done, in which the patient will be made to stand straight, closing the eyes. Sometimes the patient will fall down without balance. So for this, the observer has to stand very close to the patient to protect them from fall and injury. So safety is the priority while doing a Romberg's test. Which of the following score indicates coma in an adult patient as per Glasgow coma scale? A0, B5, C10, D12. The right answer, B5. So we all know that any score that is less than 8 can be considered coma. Other options here, 0, there is no 0 score in coma scale. Minimum score will be 3. And 10 and 12 are higher, which you cannot be called as coma. 9. A client is admitted with thrombolytic cerebrovascular accident stroke. Which of the following is a priority nursing assessment in the first 24 hours? A. Bowel movement. B. EEG. C. Skin integrity. D. Pupil size and response. The right answer, D. Pupil size and response, because usually in stroke or any other central nervous system disorder, the very clear identity indicator for problem will be the pupils. So the priority has to be given for assessment of pupils, their response, and the size. Usually in stroke there will be ascoria, there will be unequal size of the pupils seen. So this has to be assessed in the first 24 hours. 10. Decreased glucose in CSF is suggestive of. So low glucose level in cerebrospinal fluid is indicator for dash. A. Bacterial meningitis. B. Viral meningitis. C. Brain abscess. D. Encephalitis. The right answer, A. Bacterial meningitis. So why this happens? So when it comes to bacterial meningitis, what happens is a phenomena happens where there is increased glycolysis inside the CSF, which means more glucose is consumed by the pathogenic organism as well as the antibodies, which means our white blood cells who are acting against the pathogen also will consume more glucose, and the organism also will consume more glucose. Another reason is that bacteria can also stop the transport chain of the glucose molecules inside the CSF. So because of these two reasons, the glucose level inside the CSF will be reducing in bacterial meningitis. Question 11. Willis-Eggbom syndrome is also known as dash. Willis-Eggbom syndrome is also known as A. Klein-Levin syndrome, B. Klinefelter syndrome, C. Restless leg syndrome, D. Ganser syndrome. The right answer, C. Restless leg syndrome. So Willis-Eggbom syndrome is nothing but a neurological condition in which the dopamine levels will be unstable, which will cause motor issues in the patient. The patient will not be able to sit in one place. They'll not be able to keep their legs in one place. So they'll be constantly walking here and there. If they're not able to walk, they'll be constantly moving their legs right and left, up and down, etc. So that is why this disease is called restless leg syndrome. When you see the other options, A. Klein-Levin syndrome. So Klein-Levin syndrome is a sleep disorder where there is hypersomnolence, increased sleep in adolescents. It is a very rare disorder where the adolescent might sleep for more than 20 hours in a day. Option B is Klinefelter syndrome. It is a genetic disorder where there is one extra copy of X chromosome. So XXY format will be there in a male. That is called Klinefelter syndrome. And D is Ganser syndrome. It is a dissociative disorder where there will be irrelevant talk in a patient. It is a dissociation kind of phenomenon. The next question, flapping hand tremor is seen in which of the following conditions? So flapping hand tremor is nothing but it is when you make a patient stand, opening the hands on both sides, they will not be able to keep their hands like that. They'll be constantly flapping it like a bird. So this kind of symptom will be seen in dash A, uremic syndrome, chronic renal failure, hepatic encephalopathy. The right answer is all the above because flapping hand tremor will be seen in all these conditions. Number 13, if a nurse notices colorless drainage on dressing after brain tumor surgery, then which of the following is a prompt nursing action? So there is a patient who is posted after brain tumor surgery. The nurse is seeing colorless leakage from the dressing site. So what is the prompt action? A, notify the surgeon. B, elevate the head end of the bed. C, document it immediately. D, monitor client. The right answer, A, notify the surgeon immediately because colorless drainage from a head surgery site usually indicates leakage of cerebrospinal fluid, which can be very fatal. So immediate surgical repair has to be done to the leakage site. So the prompt action will be to notify the surgeon. Elevating head end, documenting, monitoring client is secondary. Question 14. A 78-year-old client is admitted to the emergency department with numbness, weakness of left arm, and slurred speech. Which nursing intervention is priority? Option A, prepare to administer recombinant tissue plasminogen activator. Discuss the precipitating factors that cause the symptoms. Schedule for a stat CT scan of the head. Notify the speech pathologist for an emergency consultation. The right answer is schedule for a stat CT scan of the head because diagnosis is very important in this condition because symptoms are indicative of stroke. But it can also be other conditions like brain tumor. To evaluate whether it is a brain tumor or a stroke or any other different condition, first CT scan has to be done and only then you can start preparing for the administration of plasminogen activator. And precipitating factors can be discussed later because that is not a priority now, and speech pathologist is also not a primary issue. It can be done later. Question 15. Which of the following would lead the nurse to suspect that the child with meningitis has developed disseminated intravascular coagulation? A, hemorrhagic skin rash. B, edema. C, cyanosis. D, dyspnea on exertion. The right answer, hemorrhagic skin rash. So there is a child who has meningitis, and which symptom will indicate that the child has developed disseminated intravascular coagulation, DIC. So usually it is a complication of meningitis where there will be an coagulation disturbance where the patient will develop petechiae and purpuric rashes, and there will be infiltration of clotted blood inside the tissues, so which will cause hemorrhagic skin rash. Other symptoms will not be seen. A 35-year-old client has undergone spinal anesthesia. The nurse should immediately place the client in dash position. So client has undergone spinal anesthesia. Which position is ideal? A, supine, B, prone, C, Trendelenburg, D, none of the above. The right answer is A, supine. Supine position is very ideal after any insertion or injection or spinal anesthesia. So this is because a supine position will minimize pain. Supine position will minimize the risk of developing headache after spinal anesthesia, and also supine position will help in repairing the punctured site. It will promote healing of the punctured site. Next question. The nurse is caring for a client who underwent lumbar laminectomy 2 days ago. Which of the following findings should the nurse consider abnormal? So a patient has undergone lumbar laminectomy. So lumbar laminectomy is nothing but a surgical procedure to treat spinal stenosis, narrowing of the spinal cord. So what happens here? Surgery is done. So which abnormality the nurse has to watch for? More back pain than the first post-operative day. B, paresthesia in the dermatomes near the wounds. C, urine retention or incontinence. D, temperature of 99 degrees Fahrenheit. The right answer C, urine retention and incontinence. So option A, more pain than the first post-operative day. So this is very common because the pain can be fluctuating in the first 1 week. Number two, paresthesia is also very common because there might be some disturbance to the nerves where the injection has been done. And option D, temperature of 99 is also common because the patient might develop some kind of infection after the surgery. But urine retention or incontinence has to be treated immediately because after lumbar laminectomy, the urine retention and incontinence will be developed when there is a symptom called as cauda equina. So cauda equina is nothing but it is damage or compression of the nerves. So this has to be treated immediately. So if there is urinary retention, it has to be immediately informed. So this happens because of compression to nerves in the L3 and L5. Question 18. A client with cervical spine injury has Gardner-Wells tongs inserted for which of the following reasons? So a person has undergone cervical spine injury. A Gardner-Wells tong is inserted. So what is the purpose of keeping this Gardner-Wells tongs? Option A, to hasten wound healing. B, to immobilize the cervical spine. C, to prevent autonomic dysreflexia. D, to hold bony fragments of the skull together. The right answer, to immobilize the cervical spine. So what is this Gardner-Wells tong? Gardner-Wells tong is nothing but it is a traction that is used to keep the head straight during spinal surgery, because constantly moving the heads can disturb the uh, spinal cord or the cervical injury. It will increase the impact of the injury. So to keep it straight and immobilize it, the tongs will be inserted. So this tong has two pins. These two pins will be inserted in the superficial area of the skull tight, and there will be a weight that will be acting as a traction behind the head. So the head will not move. So the right answer is to immobilize the cervical spine. So with this, we come to the end of this session. So keep preparing important questions. These are just a small gist of how the questions will be. You have to keep reading more. We'll also be posting more videos shortly. Request you all to prepare well and all the best. Thank you. Please subscribe to our channel.